Thank you very much. Mr. Walaline Bria.
I'm Walaline Bria and I'm from Ethiopia. It is a great privilege to be here before you today. I'm also thankful to you, honorable members of the United States Congress. Will listen to my testimony as you craft an important new piece of legislation on nutrition and HIV/AIDS. What I have to say will help you to see that nutrition and HIV/AIDS is connected and that they must be treated or addressed together. I work as a country director for Project Cancer International, a non-profit humanitarian organization working in Africa, Asia, and the Americas. Over the last half-century, Project Cancer International has worked to prevent disease, improve community health, and promote sustainable development by supporting communities to take control of and improve their own lives. In the title of this hearing, the committee asked if the President's emergency plan for AIDS relief, or PEFAR, is doing enough to fulfill the nutrition and food security of people living with HIV/AIDS. Answering this question is both simple and at the same time very difficult. In some ways, the answer is simple because the needs of people living with HIV/AIDS are so numerous that no single government, no matter how great or generous, could ever do enough. It is also simple because we know that the US government has demonstrated unprecedented leadership and great generosity in addressing the plight of people living with HIV/AIDS. I can speak on behalf of all Ethiopians when I say that we are grateful and deeply indebted for everything the American government has done and continues to do through the PEFAR program. I thank Ambassador Dibble also and extend personal thanks to him from the people of Ethiopia for his passionate and committed leadership at the helm of PEFAR. But the answer is also complex. PEFAR began as an emergency response and at the same time the sense of urgency allowed the unprecedented accomplishment in very focused areas. That PEFAR has put well over 1 million HIV-positive people on antiretroviral treatment is simply a miracle. Quickly putting so many people on treatment required a very focused mandate. As the Institute of Medicine has recommended in their evaluation of PEFAR, however, we now must move beyond the emergency phase. The need to deal with other important dimensions of this epidemic, and one of the most important is the linkage between nutrition and HIV/AIDS. Every day in Ethiopia, I am reminded of how AIDS can lead to hunger and malnutrition. I am also reminded that hunger and the desperation that it brings can drive decent people to take terrible risks, to trade their own bodies for money to buy food, and in doing so, expose themselves to HIV/AIDS. I remember a couple with 4 children, and I wish I could have brought their pictures of this family with me today. You would have seen how full of joy and hope they once were. As it happens with many millions of families across the continent, both parents died of AIDS. The children were left to fend for themselves. The eldest son was the first to leave his brothers and sisters. He went to look for work in the streets and then just disappeared. We never found out what became of him. The second child was a girl, and she took to prostitution to feed her younger siblings. After a degrading life in the streets, she became infected with HIV and eventually died. The two younger sisters' children, a boy and a girl, have now also been lost to the streets. We don't know where they are or what has become of them. What I have also seen in my country is that people who are HIV positive need food. Because of the way the disease ravages the body, an HIV positive adult may need 30% more food, and children may require twice as much of those who are not infected. They need this extra food to maintain their strength. This was the case with an HIV positive woman named Alamitu that I met at a clinic. Pregnant with her third child, she lost her husband earlier in the year to AIDS. Although she is fortunate to be on treatment, she goes hungry on days when she does not get food supplements from the clinic that dispenses her drugs. On these days, she told me her strength is drained. You can only imagine how hard it could be. It must be for her to take care of her two children when she is hungry and weak. The lack of food not only accelerates the decline into fully symptomatic AIDS, but it also means that patients have to start taking AIDS drugs years earlier, and they will die early too. HIV-positive malnourished patients who begin treatment are 6 times more likely to die than those who are adequately nourished. By including the provision of food and nutrition security in PEFAR's mandate, we can help people with AIDS delay treatment, and we can help assure that they will remain healthy and productive members of society and for a long period. Honorable Member of Congress, if you are to expand the mandate of PEFAR to include nutritional support, there are many concrete things that could be done immediately. First, and as Project Concern International is already doing in some places, we could greatly expand programs that provide nutritious meals at schools where orphans and other vulnerable children are enrolled. Second, we could expand programs that provide food at centers where pregnant women are counseled and tested for HIV. Providing this food to malnourished mothers not only helps assure that they keep coming to the clinic, but also it will also protect the health of their unborn children. Third, our programs could greatly expand the provision of food at HIV/AIDS treatment centers. We already know that many people who are on treatment are malnourished and need food. There is no reason to let them go hungry. Fourth, we can create economic opportunities for people who are affected by AIDS epidemic. We can help them start gardens and organize small savings, collectives and businesses to meet their many economic needs. While I know there may be other ways to link nutrition and HIV/AIDS, the most important thing that we can do, honorable members of Congress, is to assure that the mandate of PEFAR is expanded to include nutritional support for both HIV-positive adults and children, as well as family members whose lives have been devastated by the disease. Expanding PEFAR's mandate will help us tear down the unnecessary wall between nutrition and HIV programs, and it will go far to improve the lives of millions of people who suffer from the ravages of AIDS around the world. Thank you very much for having me this opportunity to speak to you today.
Thank you very much. We really appreciate your testimony.